Hey everyone, I'm Prateek, and in this video we're going to be looking at 5 of the biggest difficulties that I and many of my colleagues faced when we started dental school. Before we go on, I want to make you aware of Examine Dental if you haven't already heard of it. Examine Dental is a platform designed for dental students and dentists to ace your revision and interviews. Head over to Examine Dental to try hundreds of single best answer and true-false questions to help prepare for your next exam. There are lots of subscription options and you can check out further details in the description below. So let's get into some of the difficulties in dental school. When I started dental school and working through it, there were some difficulties that I wasn't really prepared for. I'd never been made aware of, no one had ever mentioned them to me. And in hindsight, had I been aware of them, I probably would have been able to prepare myself for them and I'd feel a bit more comfortable as I was going through my undergraduate degree. Because I wasn't prepared, the impact of some of these things on myself and even my colleagues was quite significant. Hopefully in this video I'll share some of those difficulties so that you're aware of them and you can prepare yourself if you are about to start a dental degree or if you're midway through a dental degree. So the first problem that I faced and the first difficulty a lot of my colleagues faced was there's a lack of free time. I found I lacked free time to carry on with normal university activities such as social activities, clubs, etc. A dental degree is quite full on. You know, you're at your lectures 9 to 5, you might be going in even earlier or finishing even later. And compared to other courses, you may be in university a lot more. Other courses often have shorter days, they may have more flexibility, more free time during the week, so students on those courses may be able to go and enjoy things within university life a bit more. Particularly in first year, I found it a bit more difficult to try and adapt to things because I was spending a lot of my time just getting used to university life. How to cope with the lectures, how to do my notes, how to prepare for clinics, all of those things were taking a lot of my time. So I wasn't really able to think about how to get a balance with the normal social life of university and my academic life in university. As the years went through, I got a better balance of this and I was able to enjoy what I was doing socially in university as well as the academic side of things. But it's definitely something that can catch dental students and even other degrees such as medical students off guard. We just don't have the same flexibility and same free time in a degree that other degrees may have. The second problem that I faced is that common misconception that all you do on a dental degree is learn about teeth. People often joke about this. They say, why do you need 5 years, 6 years, whatever it may be, to learn about teeth? But actually, when you tell them what we learn in a dental degree, it often surprises them. At Sheffield University, where I qualified, we did dissection from the diaphragm upwards, we learnt most of the physiology of the body, and we learnt about a huge number of diseases because so many diseases affect the mouth. If we compare this to something like medicine, doctors do their 5 years at university, they then go and do foundation years, and they're constantly in a training pathway as they qualify. In dentistry, on the other hand, you could potentially stop all your training after those 5 years, particularly if you don't want to do something like NHS dentistry. That means that in those 5 years, you need to be fairly competent to cover so many things to make you a good dentist when you go out into practice. That includes diseases of the body and not just the mouth. And yes, this also does mean that the easy first year that a lot of people talk about when it comes to degrees doesn't really exist in dentistry. Yes, it may be a lighter year compared to your following years, but you have a huge amount of value within your first year as well, as this lays the foundations for all the future years. And this is something that caught me off guard as well. I wasn't prepared for the amount of knowledge that we would need, not just about the mouth and teeth, but also about the general human body and medical diseases as well as physiology. However, looking back, I'm now extremely glad that I learned these things because in my day-to-day clinic life and hospital life is extremely important and it helps me a huge amount when I'm seeing patients. The next thing that I particularly struggled with is the idea that you're average. You spend all those years in high school, in college, your sixth form, whatever it may be, working really hard, trying to get all the top grades, doing all your entrance exams, and you get into university and you finish top of your year to get into a dental degree. But once you're there, you're the same as everyone else. Everyone else got the same grades, everyone else did the same exams, that everyone else has the same attitude and motivation towards their academic life. And this just puts you in the middle of everyone. You're just very, very average. And yes, through the years, people will separate out. Some people will excel, other people may slow down a little bit. But overall, you're very, very similar. And that means that those marks that you used to get in high school of 80, 90% suddenly become 60, 65% on your first assessment. And you suddenly realize that those glory days of high school, of sixth form, college, they don't exist anymore. But that's normal, that's what university is like. I went through this myself and sometimes I felt quite mediocre, particularly in first year, because I wasn't expecting this to happen. But actually, as time went on, I realised that this was normal for university, and I used it to motivate myself to work harder and still strive for those high marks, even though it's a lot more difficult potentially in university. The fourth thing that I struggled with was patient management. When we started seeing patients on clinic, it was quite difficult to hide the anxiety that you had. You know, you might be seeing a patient for the first time and delivering your first injection. They don't want to see that you're anxious. They don't want to see that this is the first injection that you're doing on a patient. So you need to change how you act, you need to change your behavior, and you need to be confident with what you're doing, even though you probably aren't. You also very quickly realize that you need to be putting patients first. So if you've done some clinical work and it just hasn't gone the way that you wanted it to, it's then down to you to correct this. That may mean that you have to come in for extra clinics, you may miss your lunch, you may work over, and this isn't something that would typically happen in another degree, but it's your responsibility, and that's something that is going to be the case for the rest of your life, and you have to learn that very quickly at university. And that leads on to the last thing that I want to talk about, and that is that you have to start following the standards of the General Dental Council. You'll quickly learn about the 9 principles that the General Dental Council, the 9 standards that they have in place, and these are all the standards that anyone registered with the GDC should be demonstrating. So although you're a student, you still have to be professional, as these are the standards you'll be assessed by, and at the end of your degree, the university has to put forward whether you're professional enough to actually be registered on the GDC. So you don't want to be caught doing anything stupid in university. You don't want to have criminal convictions, for example. All of these things you need to be aware of that as a student you probably don't think about, but actually could have significant ramifications later on in your career. Along with that, you need to be staying up to date with the latest evidence, any technology changes, and all of this is a lot for a student who's just at university doing a degree, but these are the expectations that come of you as you're following a dental career. So I hope you found this video useful. We've covered some of the major difficulties that myself and my colleagues faced as we went through university. I hope this helps you if you're going through university now. If you did find this video useful, please like, comment and subscribe, and share it with your colleagues. Until the next video, take care.